Did you know that heart disease is the leading cause of death worldwide? Every year, millions of people suffer from heart attacks, heart failure, and other serious cardiovascular conditions. And here's the scary part. Many of these problems start silently. Your heart might be struggling, yet giving off subtle warning signs that most of us overlook. Today, we're going to talk about 7 heart warning signs you should never ignore. These aren't just minor discomforts or things you can brush off. Recognizing them early could save your life or the life of someone you love. We'll cover symptoms like unusual fatigue, chest pain, shortness of breath, swelling, irregular heartbeat, dizziness, and even persistent coughing. I'll explain why these symptoms happen, what they mean, and what you should do when you notice them. By the end of this video, you'll know exactly what to watch out for and how to take action to protect your heart. So let's start with the most common and perhaps most alarming warning sign: chest pain or discomfort. Chest pain or discomfort. Chest pain is the classic heart warning sign. But here's the tricky part. Not all chest pain means a heart attack, and not all heart attacks start with severe chest pain. Heart-related chest pain often feels like pressure, tightness, squeezing, or heaviness in the center of your chest. Some people describe it as if an elephant is sitting on their chest, but it can also radiate to your arms, shoulders, neck, jaw, or even your back. It's important to differentiate between heart-related pain and other causes. For example, chest pain from acid reflux often comes with a burning sensation and may worsen after eating. Pain from muscle strain is usually sharp and localized and may worsen with movement. So when should you be alarmed? Seek immediate medical help if your chest discomfort comes with shortness of breath, nausea or vomiting, cold sweats, lightheadedness. Let me share a story. John, a 52-year-old man, felt a mild tightness in his chest after climbing stairs. He ignored it, thinking it was just fatigue. 2 days later, he suffered a heart attack that could have been prevented if he had acted sooner. Risk factors that increase the chance of heart-related chest pain include high blood pressure, high cholesterol, diabetes, smoking, sedentary lifestyle, family history of heart disease. Here's a practical tip. If you ever feel unexplained chest discomfort, especially if it's new or different from usual sensations, don't wait. Call emergency services immediately. Remember, early action saves lives. Chest pain is not something to take lightly. It's your body's way of saying, "Pay attention to me." Shortness of breath. Shortness of breath might seem harmless. Maybe you just climbed a flight of stairs or ran to catch the bus. But unexplained shortness of breath can be a subtle warning that your heart is struggling. Why does this happen? When the heart cannot pump efficiently, blood can back up into the lungs, causing fluid accumulation. This makes it harder to breathe. Some people notice it only during physical activity, while others feel it even at rest or at night when lying down. Here's how to tell if it's heart-related. Shortness of breath occurs suddenly without exertion. It wakes you up at night. It comes with swelling in the legs or feet. It's accompanied by fatigue or irregular heartbeat. Maria, a 60-year-old woman, experienced mild shortness of breath while gardening. She thought it was just aging. After weeks, she went to her doctor and was diagnosed with early-stage heart failure. Early detection allowed her to start treatment immediately. Shortness of breath can also come from lung problems, so it's important to get checked. A doctor can perform tests like echocardiograms, ECGs, or blood tests to determine if the heart is the culprit. Practical tip: keep a daily log of your breathing and activity level. Note any unusual fatigue, breathlessness, or swelling. This record can help your doctor catch heart problems early. Unusual fatigue. Fatigue is something most of us experience, but chronic, unexplained fatigue can be a heart warning sign. Your heart pumps blood, carrying oxygen to every cell. If it's struggling, your organs and muscles receive less oxygen, making even simple tasks exhausting. Unlike regular tiredness, heart-related fatigue is persistent, overwhelming, and often worsens with activity. Consider the story of Alan, a 55-year-old accountant. He felt constantly drained and assumed it was stress. He ignored it for months until a routine checkup revealed heart disease in its early stages. With proper treatment and lifestyle changes, he recovered. Signs that your fatigue may be heart-related include feeling tired, even after adequate sleep, difficulty performing daily tasks, shortness of breath during mild activity, swelling in the legs or feet. Practical advice: track your energy levels for a few weeks. Note sudden changes in stamina or endurance. Pairing this with other warning signs like swelling or palpitations can help doctors diagnose heart problems early. Swelling in legs, ankles, or feet. Swelling in your lower extremities is called edema, and while it can be caused by diet or standing for long periods, persistent swelling may signal heart problems. When the heart isn't pumping efficiently, blood can pool in the lower body, leading to fluid retention. You might notice puffy ankles that leave indentations when pressed, shoes that feel tighter than usual, sudden weight gain. Take Susan, for example. She noticed swelling in her feet and ankles but attributed it to standing at work. Over time, she developed shortness of breath and fatigue, prompting a visit to her doctor. She was diagnosed with early heart failure. Other clues that swelling is heart-related, accompanied by shortness of breath. Swelling worsens throughout the day. Edema occurs in both legs. Tip: elevate your legs, reduce salt intake, and monitor daily weight. But don't ignore persistent swelling. Consult your doctor to rule out heart issues. Irregular heartbeat or palpitations. Do you ever feel your heart flutter, race, or skip beats? These sensations, called palpitations, can sometimes be harmless, but they can also signal a serious heart problem. Common causes of palpitations include stress, caffeine, or dehydration, but if they occur frequently, irregularly, or with other symptoms like dizziness or chest pain, it's a warning sign. Types of arrhythmias to watch for: atrial fibrillation, AFib, irregular rapid heartbeat, ventricular tachycardia, fast heartbeat originating from the ventricles, bradycardia, unusually slow heartbeat. Practical tip: use a heart monitor or app to track palpitations, noting the time, duration, and associated symptoms. Bring this log to your doctor for proper evaluation. Ignoring palpitations can increase the risk of stroke, heart failure, or sudden cardiac arrest. Early intervention is key. Dizziness, lightheadedness, or fainting. Feeling dizzy, lightheaded, or fainting can happen for many reasons: dehydration, low blood sugar, or even anxiety. But sometimes it's a sign your heart isn't pumping effectively. When the heart fails to deliver enough blood to the brain, you may feel sudden dizziness, lightheadedness when standing up quickly, brief loss of consciousness. Case in point: Tom, a 58-year-old teacher, experienced brief fainting spells. He assumed they were stress-related. A heart evaluation revealed arrhythmia that required immediate treatment. Warning signs that shouldn't be ignored. Occurs frequently or suddenly, accompanied by chest discomfort or palpitations, leads to falls or injuries. Tip: monitor blood pressure, heart rate, and note triggers for dizziness. Seek prompt medical care if episodes are frequent or severe. Persistent cough or wheezing. A persistent cough or wheezing may seem like a minor annoyance, but it can be linked to heart failure. When the heart struggles to pump efficiently, fluid can accumulate in the lungs, causing a chronic cough, wheezing, or shortness of breath. Signs that your cough may be heart-related. Worse at night or when lying down, produces white or pink-tinged mucus, accompanied by swelling, fatigue, or weight gain. Many people mistake this for a cold or asthma, delaying treatment. Early diagnosis and intervention can prevent complications. Tip: keep track of cough patterns, triggers, and associated symptoms. Consult your doctor to rule out heart problems. How to respond to warning signs. If you notice any of these warning signs, don't wait. Here's what to do. Seek immediate medical attention for chest pain, severe shortness of breath, or fainting. Track symptoms over time. Use a journal or health app. Schedule regular checkups and screenings, especially if you have risk factors. Adopt a heart-healthy lifestyle. Balanced diet, regular exercise, stress management, quitting smoking. Know emergency numbers and have a plan for sudden symptoms. Early intervention is key. Ignoring these signs can lead to severe complications or even death. Your heart communicates constantly. Listen and act. Your heart is incredibly resilient, but it can also give subtle warning signs when something is wrong. Recognizing these signs early and taking action can save your life. Don't wait for a major event to make changes. Listen to your body, track symptoms, and seek medical help when necessary. Share this video with loved ones. It could save someone's life. Subscribe for more health tips, and remember, your heart health matters every single day.